Hi everyone, my name is Dr. Manik Madaan. I'm a PGY-2 resident here in the United States, and in this video we will dive deep into how to become a doctor in Australia for international students. This video is divided into 7 parts. The first part is about the benefits of becoming a doctor in Australia. The second one is the pathways to become a consultant in Australia. Third is the exams required, and fourth is how's residency training like. Fifth is salary plus lifestyle of attending doctors. Sixth is how much does it cost to become a doctor in Australia, and seventh is visa and immigration. So let's start with the benefits of becoming a doctor in Australia. The first benefit is after you become a consultant, the degree that you get is globally recognized in UK, Canada, Middle East, Singapore, New Zealand, India, and so on. Secondly, this pathway is far more affordable compared to USMLE and PLAB, and you will find out more about the total expense with different pathways as I dive deeper into the cost in later parts of the video. Third is the junior doctor salary when you start. So this is basically the intern salary for PGY1 is about 70,000 Australian dollars. The average salary of a general practitioner is about 300,000 Australian dollars. For consultant salaries, it's 250 to 500,000 Australian dollars. If you're in the private sector, which is possible unlike USA and UK, which take a lot of time with immigration, you can make millions in Australia. One of the best parts is that the green card or permanent residency, you get it within 2 years of getting your full registration, which means after you finish your internship. And citizenship, you'll get it within 1 year of getting your green card or permanent residency. Now let's go into different pathways to become a doctor in Australia. The first pathway is the standard pathway, and this pathway is the most common pathway that's taken by recent medical graduates who are not specialists. Generally, the second pathway is competent authority pathway. The Australian Medical Council recognizes certain countries as having medical graduates equivalent to its own, and so they don't need to write AMC exams. The third pathway is the specialist pathway, where if you're a trained specialist, you can apply and bypass AMC exams and you can apply directly for specialist recognition. So these pathways, you can bypass AMC exams. With standard pathway, you have to give AMC exams. Now let's jump into standard pathway, and this is the whole standard pathway as we will go through step by step. So the first part is your med school eligibility check. This you can do via the links mentioned below. I will mention all the links. You can go to the Australian Medical Council's website and run an eligibility check to see if your medical college is recognized by the AMC to participate in the standard pathway. The second part of the process is opening your EPIC account. EPIC stands for Electronic Portfolio of International Credentials. It's a service run by ECFMG, which is a US based company. You would also be familiar with ECFMG if you've done USMLE. It's the same company that's running EPIC. And what you need to do is you need to open your EPIC account and upload your whole CV into EPIC, and they will run an identity verification about whether you're a real person or not. After this, you will establish your Australian Medical Council portfolio, which is a portfolio of all your CV, all your medical degrees, everything in one place so that the AMC can have a look at it. You also need to recognize that AMC is contracting out the work of the verification of your identity and degrees to ECFMG, and ECFMG does this via the EPIC account. Like the first process is again your identity verification, after which you will make an AMC portfolio, and the second part of the EPIC verification is medical school degree verification. This is also called as primary source verification, where EPIC will verify whether you've actually graduated from your medical college or not. After this, you have to write your AMC Part 1 exam, which is a multiple choice question exam. Once you pass your AMC Part 1 exam, you can actually apply for a job. But again, this is an optional path. Once you do your AMC exam, you do need to write your OET, IELTS. And if you are able to do those things, you can directly apply for a job, which is a paid job. If you get an interview, get an employment letter, you can go to work under Australia under limited registration and work there for a year as a junior medical officer. You'll again be paid a salary of 60 to 80,000 Australian dollars. Medical graduates can either go to this route of the pathway, or they can bypass this and directly write the Part 2 clinical exam. Also, there is an alternative to the Part 2 clinical exam because some people consider it hard, so they have this alternative called the WBA or workplace based assessment. I will dive into this later as well. After you're done with both your AMC Part 1 and Part Part 2 exam, you can apply for what is called as provisional registration to work in Australia as an intern, which is about 1 year internship. You'll be paid for this. Once you do your 1 year internship, you can get general registration and you can enter residency training. There's a slight bit of confusion that this residency, when you look at it, people think that this is postgraduate training. Here it's not quite the same, and I will clear up this confusion later. After this, you do registrarship. So registrarship is the equivalent of residency training like general medicine, internal medicine, surgery, obstetrics and gynecology. Residency training is more like core training, if you have heard about it, in the UK. After this, you can work as a consultant. The second pathway is called as the competent authority pathway. Competent authority pathway is a pathway that medical graduates from US, Canada, UK, New Zealand and Ireland, as well as certain IMGs who have done USMLE and PLAB, can use to bypass the AMC exams. So what is the meaning of competent authority pathway? The Australian Medical Council recognizes the following competent authorities that graduate medical students into doctors as being as competent as their own council, and hence the medical graduates from these countries where these competent authorities lie as being equivalent to its own. So logically, graduates from these countries do not need to write Australian Medical Council exams because they are equivalent to a medical graduate in Australia. The following are the competent authorities: the GMC from UK, Medical Council of Canada, the Liaison Committee of Medical Education USA. This is basically the MD programs in the United States. The next is National Board of Osteopathic Medical Examiners, COMLEX USA. This is the DO degree that you would have heard of in US. The fifth one is Medical Council of New Zealand, NZREX. Sixth one is Medical Council of Ireland. And the last one is IMGs who have written PLAB and USMLE. But you just don't need this. You need another component that many people miss, and that is you need experience. For medical graduates from UK, New Zealand, Ireland, you need at least 1 year of supervised clinical training. This could be like when you go to the UK, there's foundational year training. So you need at least like a non-training job where you work for at least 1 year. If you have done PLAB, you can also do this 1 year of supervised clinical training and directly bypass any AMC exam and apply for provisional registration. If you are a medical graduate from USA or Canada, or you have done USMLE, you need 2 years of supervised clinical training, and this is residency training in the US because there's nothing such as a non-trainee job in the United States. The whole pathway is summarized as below. So the first thing you need is again a medical school eligibility check, which is on the Australian Medical Council website. The next part is you need to open your Epic account and get your identity verification done, after which you establish your AMC portfolio just like the standard pathway, and you need to get your medical degree verified via Epic. After this, you don't need to write any AMC exams. You can directly bypass all of them and get provisionally registered with AMC before applying for a job, which is a 1 year internship. This is also called as PGY-1 in Australia. It's a non-trainee job. After this, you apply for general registration and then do residency, registrarship, and then become a consultant. So quite similar to the standard pathway, except you don't have the AMC exams here. Next pathway is the specialist pathway. Specialist pathway is for international medical graduates who have trained abroad in a particular specialty like internal medicine, pediatrics, psychiatry. They finish their residency training, plus they have a fellowship. You don't always need it, but like it's generally recommended. As well, you need 3 years of clinical practice after you have done both residency training and fellowship. So after you have done that, you are considered overseas trained specialist who can use the specialist pathway and bypass the AMC exams. Under this, there are 3 sub pathways. The first one is you're applying for specialist recognition, which means that as a overseas trained specialist, you are applying for them to assess you if you are comparable to Australian trained specialist. The second is area of need recognition. What that means is there are places in Australia which are in need of specialists because the native specialists who were trained in Australia don't want to go there, and for this apply for assessment and see if you can get area of need recognition to practice in those remote spots in Australia which are in need of doctors. The third sub pathway is you apply for both specialist and area of need recognition at the same time. The way this pathway works is similar to standard pathway, the competent authority pathway, you have to get your identity verified by Epic, and then your AMC portfolio done, as well as your medical degree verification done. And here you have 2 medical degrees, which is your primary medical school degree and then your specialist degrees that you have obtained. So these steps are pretty much the similar. What differs here is you are going to apply to specialist colleges. Specialist colleges are specific colleges in Australia which train specialists called as fellows, and they assess whether you are comparable to an Australian trained specialist or not. Once you apply to these colleges, they'll conduct an initial assessment which would include both your CV check as well as an interview to clarify certain doubts in the CV. It would take about 3 months for them to give an assessment outcome, which could be out of the 3 of the following. The first one is you are not comparable at all to an Australian medical specialist, leading to you becoming ineligible for this pathway, and so you have to go either via the standard or the competent authority pathway. The second one is partially comparable, which means that you are somewhat comparable to an Australian trained specialist. However, there are still significant clinical gaps that need to be addressed, because of which the training period is generally longer under a consultant for you to get specialist recognition. If you are deemed partially comparable, you get limited registration to practice and train in Australia under supervision of a certain program, and then you can train for 2 years at least to become a consultant. If you are deemed substantially comparable, what that means is your clinical knowledge is at par with an Australian trained specialist, so you just need to train for at least a year to become a consultant who can practice. Similar to partially comparable, you are given limited registration to train in a certain college under supervision, after which it takes just 1 year to become a consultant. Next part is the exams. For AMC, there are 2 exams, AMC Part 1 and AMC Part 2. AMC Part 1, it's a MCQ exam, so multiple choice question. It tests your clinical knowledge, and this is very much unlike the USMLE Step 1, which is more about basic sciences. It consists of 150 multiple choice questions that you have to answer within 3.5 hours. You can take it online anywhere in the world via Pearson VUE centers. The wait time for the slot once you register for your Part 1 is about 3 months, which is unlike PLAB 1, which my friends tell me takes about 12 to 18 months to just get a slot. Once you register for AMC Part 1, you have a 12-month validity period for your application. You have to apply within these 12 months. One of the best parts about AMC Part 1 is it has unlimited attempts, which is unlike USMLE and PLAB. There's no negative marking, and the score is valid forever, unlike USMLE and PLAB. You get access to a paid job directly after PLAB 1. If you can secure one, you can work under limited registration there. USMLE, PLAB do not offer this. For USMLE, you need to write your Step 1, Step 2 and OET to actually match into a residency program so that you can practice. For PLAB, you need to write your PLAB 1, PLAB 2 and OET to get into foundational year 1, which you have to fight for. So unlike USMLE and PLAB, you are getting access to a paid job directly after Part 1, which is surprising to me. The whole exam is scored from 0 to 500 and the passing score is 250. The results are announced in about 4 weeks. The pass rate is a 60% pass rate, which some people might consider to be very low. I would like to point out that as I've talked to my friends who have gone to Australia, this pass rate has a negative skew to it. The reason that is so is because most graduates who apply via the standard pathway and take the AMC exams are medical graduates who have significant gaps in their clinical knowledge because they have been out of med school for a long period of time, leading to them having a 60% pass rate. It's actually much higher for recent medical graduates, so do not let that scare you off. The other surprising part about AMC Part 1 is no IELTS or OET is required for AMC Part 1, which is unlike PLAB 1 where you need IELTS and OET to write that exam. However, IELTS and OET is required for you to get some form of registration in Australia. The main recommended resources for AMC Part 1 is for books. You need John Murtagh's General Practice book, official AMC Handbook of MCQs. For question banks, there's the Amidex and the AMC Question Bank that you can get. Many of my friends also recommend doing previous year recall questions. So you can do the last 5-year questions and they will help guide you in the exam to perform better. For prep time, if your basics are strong, it takes about 2 to 3 months to prepare for AMC Part 1. If your basics are weak, it takes 4 to 6 months. Next is AMC Part 2. So AMC Part 2 is a OSCE exam. OSCE stands for Objective Structured Clinical Exam. It tests your clinical knowledge, which implies your history taking, physical examination, differential diagnosis, diagnosis, formulation, as well as recommendation of treatment plan. And it tests your clinical skills in adult medicine, surgery, women's health, pediatrics, psychiatry, as well as social skills. That is how you interact with the patients. It consists of about 20 stations. In these 20 stations, you have 16 clinical stations and 4 rest stations. 16 clinical stations, out of this, 14 of them are scored and 2 of them are not scored. Each station is 10 minutes, consisting of 2 minutes of reading time for that case and 8 minutes of assessment time. The total exam is about 3.5 hours long, just like AMC Part 1. AMC Part 2 used to be offline and graduates had to fly to the National Test Center in Melbourne, Australia to give it. However, in the past 2 years, they have shifted to an online format where you can now take it from all over the world. The typical wait time for a slot is about 6 months. You can take this exam limited number of times. There's no negative marking. Your score is valid forever. However, the caveat of this exam is the 28% pass rate. I would again like to emphasize that this exam is mainly taken by old medical graduates because many recent medical graduates are not familiar with the Australian medical exams, and so they don't take it. Most of them go to USMLE and PLAB. So there is definitely a negative skew because these old graduates take the AMC Part 2 and then because of the gap in their knowledge, they end up failing, causing the pass rate to go significantly down. It's not as low for recent medical graduates. The second point I would like to make for this is that if you find it really difficult, you can always take a workplace based assessment, which is an alternative to Part 2, and you can bypass AMC Part 2 through the WBA. However, you need to be in Australia working in a job where they provide you the workplace based assessment. That's hard to get. Again, the surprising part about this exam is there's no IELTS or OET required. Study material for this exam consists of the AMC Handbook of Clinical Assessment, Karen short notes. You can find all of these online. AMC Clinical Marwan notes are pretty good as well. For question banks, so your previous knowledge from AMADAX and AMC question banks shall work out for you. You don't need to repeat them, but just mentioning that these question banks would be helpful for you to consolidate your clinical knowledge. For videos, you need Tally O'Connor's EdExam videos. You can complement your knowledge through that. Geeky Medics on geekymedics.com also have great videos. I'll mention the links below in the description. Prep time generally for this exam is 3 to 4 months, 8 to 10 hours a day. This is variable for different people based upon how strong their basics and clinical knowledge are. OET and IELTS, you also would need an English proficiency exam to apply for any kind of registration. You can either take OET or IELTS. These exams are required for limited, provisional, general and specialist registration at the least. So you cannot apply to AMC for registration without these exams. You can take OET or IELTS anywhere online. There are worldwide centers for these. For OET, you need a minimum passing score of B in each of the 4 components, which is listening, reading, writing and speaking. For IELTS, you need a minimum overall score of 7 in each of the 4 categories, which is listening, reading, writing and speaking. Technically, if you ask people and if you ask me, OET is far easier than IELTS. Everyone goes with OET. However, OET is more expensive than IELTS. So yeah, there is a bit of trade-off in difficulty level and the price. Study material for OET, sample questions on the official website are good enough. And you can also take a free course which is offered by ET2 OET, and that's all you need. That's what I used for my preparation for OET. Next, let's talk about residency training. Here I'm going to address a lot of confusion around what is residency training in Australia and a lot of the terminology. Once you apply as an international medical graduate, you are applying for the internship, and the only way to get into internship is to have provisional registration. After you're done with your AMC exams, you apply for provisional registration and then you get into internship, which is PGY-1 here. After you're done with your internship, you apply for what is called as a residency. This is pre-vocational training, not specialist training. It is more equivalent of internship extension. You're just going through different parts of medicine and finding out which part of medicine do you like or not. So after this, after doing at least 1 to 2 years of residency training, can you apply for what is called as registrarship or specialty training. Registrarship is equivalent of postgraduate training like internal medicine, pediatrics, or OBGYN, surgery. That is what registrarship is. The levels before that are just you working there as a junior medical officer, be it internship or residency. After registrarship, you can apply for fellowship for extra training. Registrarship is about 3 to 7 years long. Total training duration comes to about 5 to 9 years in total, consisting of 1 year of internship, 1 to 2 years of residency, and 3 to 6 years of registrarship. Work-life balance as a junior doctor. So this means your internship, your residency training, your registrarship is you work 5 days a week, 40 hours a week. And if you cross the 40 hours a week, it's considered overtime for which you're given compensation. You also get 5 weeks of paid vacation during a year. There are no 24-hour calls unlike the United States system. Salary wise, the intern base salary is between 60,000 to 80,000 Australian dollars per year. This comes to about 1,350 Australian dollars per week when you're considering a 40-hour work week. So the base salary is about 33 Australian dollars per hour, and it increases by 10,000 Australian dollars every year as you climb the hierarchy, let's say from PGY-1 to PGY-2. So if you're a PGY-1 resident, you're earning about $70,000 per year. In PGY-2, you'll be making 80,000 Australian dollars per year. So it'll keep increasing. Salary for the same position increases by 2.5% every year to adjust for inflation. If you're in PGY-1, the next year, the salary for PGY-1 would increase by 2.5%. So technically, in 5 years, a PGY-1 would be earning the same salary as a PGY-2. For overtime, the compensation rates are as following. For the first 2 hours after you cross the 40-hour mark, you are given 1.5 times the base pay. And after you cross these 2 hours, you're given 2x the base pay. If you're working Saturdays and Sundays, so basically the weekend, you're compensated for that. So 1.75x the base pay for Saturdays and 2 times the base pay for Sundays. If you're working public holidays, you're given 2 times the base pay plus an additional day off in that year to compensate for you working the public holiday. 1.5x the base pay, the $33 would be about 50 Australian dollars per hour. 1.75x the base pay would be $58 per hour, and 2x the base pay would be $66 per hour. An example of like a PGY-1, which is an intern working 70 hours per week, would show us that they would make about 170 Australian dollars per year, which is equivalent to USD $110,000. And the average salary of junior doctors in America is $64,000 per year. So this is almost double, which is wow. Now let's talk about attending doctor salary and lifestyle. As an attending doctor, you generally work 5 days a week, 40 hours a week, and you are compensated for your overtime. Just like the junior doctors, you get 5 weeks of paid vacation, and there are no 24-hour calls unlike US. Salary wise, Australian doctors make generally from 300,000 to 1 million Australian dollars yearly. As general practitioner, you would make on an average 300,000 Australian dollars per year. A consultant on an average would make 400,000 Australian dollars per year, and a private practice physician can make up to 1 million Australian dollars per year. These are amazing salaries, and again, remember that these salaries are for the 40 hours per week of work. So that's the base pay. If you work more, you get more. The cost. How much does the Australian Medical Council pathway cost? For the standard pathway, here are the following costs for each of the steps. So the medical school eligibility check is free. To open the Epic account and get your identity verified, it's gonna take you about 200 Australian dollars. To establish the AMC portfolio, it's 600 Australian dollars. For Epic medical school degree verification, you need 1 credential verified. It's gonna take you 154 Australian dollars. The AMC Part 1 MCQ exam is quite expensive at 2,920 Australian dollars. If you take the optional step and apply for a job after AMC Part 1 and get limited registration, this will cost you about 1,855 Australian dollars. AMC Part 2, if you take it online, would cost you 4,130 Australian dollars. If you take it in the National Test Centre Melbourne in Australia, it's cheaper, 3,730 Australian dollars. The workplace based assessment, if you have that available in the job setting where you're working, it will cost $1,000. WBA is the cheapest option if it's available to you, and it's easier to pass than the AMC Part 2 clinical exam. Provisional registration, which you need to work as an intern, would cost you 920 Australian dollars, and general registration, which you do after 1 year of internship, would cost you 1,855 Australian dollars, just like the limited registration. The total cost without limited registration, if you don't take the option step, is 10,800 Australian dollars. Total cost with limited registration is 12,600 Australian dollars. Now let's talk about the competent authority pathway. Some of the steps again are the same as the standard pathway. Medical school eligibility check is free. Epic account would cost you 200 Australian dollars. AMC portfolio would cost you 600 Australian dollars. The medical school degree verification via Epic is 154 Australian dollars. You bypass the AMC exams where you're saving the most amount of money, directly applying for provisional registration, which is 920 Australian dollars. General registration is 1,855 Australian dollars. The total cost comes to about 3,700 Australian dollars, which is not as expensive. Specialist pathway, how much does that cost? So for specialist pathway, you would again do the medical school eligibility check, which is free. Open the Epic account, which is 200 Australian dollars. The AMC portfolio portfolio is 600 Australian dollars. Epic med school degree verification, which is primary source verification, is more expensive here because you're getting at least 2 degrees verified, so it would come to about 308 Australian dollars, which is double of what you would pay in other pathways. Here there is no concept of provisional registration. There's what is called as limited registration, where you'll be training as a specialist in Australia. That's $1,855. It's more expensive than provisional registration. Special registration is quite expensive, 2,495 Australian dollars. In total, the cost would come to about 5,500 Australian dollars. Now let's talk about visa and immigration, which is one of the best parts about the AMC pathway. Firstly, to work any job in Australia, you would need a visa. The visa you typically get is the work visa 482, also called as the temporary skill shortage visa. This is a 2-year visa which can be extended up to 2 years for a maximum of 4 years of working in Australia. Once you are able to achieve your full registration, you can apply directly for green card and PR, and it takes about average of 2 years, which is super fast. And if I were to go the USMLE route, it would take me 14 years to get a green card in USA. If I were to do the same thing via the PLAB route and apply there, get a PR in UK, green card in UK would take me about 5 years. So this is the fastest pathway to get a green card. The citizenship is within 1 year of permanent residency. The best part about having a green card this fast is it opens doors for private practice. Since you don't need a visa anymore to work for a certain hospital, you can just work for yourself. So guys, thank you for watching. If this video helped you, please give me a like and subscribe as well for more content relating to becoming a doctor in Australia and other countries.